half a team
Hi,
injured.
folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
Oh, and our opinion, of
Boy,
course,
that felt
Bob.
good, Brad. That felt really good. Okay, today, Brad, we're going to talk about best 7 mobility exercises of the hip to decrease hip pain and improve flexibility.
Right.
I kind of butchered that a little bit.
Yeah, you did, Bob, but that's okay. You're still getting your frustrations out with that.
That's right.
Yeah, that's
Feels good, though.
inside joke there. Anyways, with the hip, you know, there's one of the most painful joints in the body for a lot of people with arthritis.
Because you got a weight bear, you got to walk.
Right.
You can't avoid it. I mean,
Right.
it's not like a shoulder where you can kind of baby it. I mean,
So it could be arthritis, bursitis, tendonitis. A lot of itis is going on around the hip because it's taking a lot of weight-bearing activity.
and generally what we have found is the tighter the hip gets, the more the pain increases. If you can loosen up the hip, a lot of times the pain decreases. And,
Right.
And in fact, even if you can gain a little bit,
Sure.
a lot of times that little bit is going to help decrease the pain.
Should we review the little bit of biomechanics of the hip or the lot of bit?
Brad, before we do that, I want to introduce you to our channel. Please take a second to subscribe to our channel. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, if you haven't already, wander over to Facebook and like us, because over there we try to give away stuff for free. That is giving away stuff, right? Free.
For free. You get it.
And
go
also,
on, Bob.
make sure you like us, because Brad and I as children were not liked, and we're trying to turn things around.
And
All right.
it's working out well for us, Bob. But let's look at the hip once. So the hip is a really straightforward
Ball
joint.
and socket.
Yeah, it's a ball and socket joint.
Yeah.
And you know, it flexes forward this way, you know, and it can go up about to here, 130 degrees. Going backwards, it's limited though, Bob. You know, you're going to go back about 20 degrees perhaps, and then out to the side.
Abduction.
Abduction, you're not going to get real far out. Some of those gymnast people, you know, they make the hip look like it's made out of rubber sometimes. It's amazing. A lot of athletic people can do that. But the average person, particularly if you do a lot of sitting, your hips can really tighten up and it can start to cause problems.
Yeah, and with arthritis, it tends to tighten up in a certain pattern. So, but we're going to want to make sure you stretch all directions.
Right.
I mean, we don't really need to go into that. Do we?
Exactly. So we're going to make this is just a little easier to work with than Napoleon. Yeah. So here we got the leg come off, so I can easily stretch it. We're going to talk about flexion. We're going to extend it, and then we're actually going to show you a way to externally rotate it while you flex it, which is really kind of like this. And it's just amazing how good these stretches could feel.
And then abduction too.
Abduction, exactly.
Yeah.
And typically, a lot of times you're combining the motions, Bob.
Right. I was just going to say, do you have abduction on there? I don't know if you do.
Well, in a sense, I don't know why you say that, Bob, but I figured, well, you must know what you're talking about. I'm just kidding.
All right, we'll throw an abduction one in there.
Right.
All right, first one you want to do is extension and line. Do you want me to do that, Brad?
Sure. Now, this one you might say, what's this got to do with the hip? Because it looks like he's stretching his back, which is true. You're getting a nice low back stretch, but at the same time, the hip flexors, the iliopsoas muscle, is getting a nice stretch here as well.
Now, a variation off of this, should I show that, Brad?
Sure, yep.
Would be to, actually, if you're somewhat limber, you go off the side of your bed like this.
Yep.
And I'm going like this, and now I can go up like this, and now I'm really focused on one hip.
Right, yeah.
I'm really getting
You can see
on
that
the left
right
side.
here. Yep.
That's really a good stretch.
Yep. Well, should we, you know, if you don't want to work off your bed, we used to have a pillow.
Right.
Ronnie, you want to throw us
I'll
a
grab
pillow?
a pillow.
If you have a carpeted floor, you can use that's usually enough. Or
Yeah, you don't want to do this. There we go.
yeah, don't do it on a hard floor because it's going to give you some bursitis in your knee. But here, we stretch here, up good posture. And some people get a good stretch when they're down like this as well. You get a flexion stretch. Actually, you work one side in extension and the other hip in flexion, getting two birds with one stone.
That's right.
There you go.
Very
All right.
well done. Hook rotation. You want me to do that?
Sure,
Brad?
yep.
Can I have the pillow?
Oh,
Well, it's probably all dirty now. It's on the floor.
don't worry about it, Bob.
All right. So we're doing this type of thing, Brad. We're rotating. We're working on some rotation of the hip.
Right. And again, this is one of those things. You also get some mobility in the low back and the thoracic spine a little bit.
And you can even swing her over, right?
Yep.
And you get a little more rotation. But actually, that probably wouldn't rotate the hip as much. That's probably more in the back.
Right, but you're still going to work some of the hip. Now, you can go both directions as long as it feels comfortable. And as the more you do, if it feels like you can go a little farther each time, that's wonderful. That's what we're looking for.
And I'm keeping my shoulders down.
Right.
And this is a great one to do in the morning to loosen up your hips and loosen up your back. This we prescribe this one all the time. And we do have people start off just maybe with small oscillations.
Right.
And then have them move into larger ones as time goes on.
Especially if you have a tight hip, arthritic hip, a painful hip, you're going to work. You're not going to force it into pain. You're going to work with it and try to get through the pain gently.
Yeah, you want to promote that synovial fluid, which is kind of like, well, again, I always remember a patient called it snowmobile fluid. No, it's a synovial fluid. It's kind of the body's natural grease.
Lubricant,
or lubricant. And you want to get that moving and going before you even get out of bed in the morning. So that's a great one to do.
Right.
So,
and along with this one, you want to go or you want me to?
Sure.
Go ahead. After you do the hook rotation that we just did, you can do single knee to chest would be a good way to start, just like that.
now, if you have trouble with this, you can take a sheet and put it on. Do you want to throw me that strap?
Yes,
Ben?
I do, Bob.
You do mind or you don't?
Well,
you will do it.
I do mind, but I'm going to do it anyways because I'm a nice guy. There you go.
All right, so this is the yoga strap, and we have this listed in our product section below. This works out kind of nice for this because you can put it underneath the knee, and you can grab one of the loops here, especially if you have arthritis and it's difficult for you to grab onto things.
Right.
And these are offset loops. That's what I like about them too.
Yep, they are. They're easier to get into.
You can go a single knee to chest like this.
This would be a towel roll, and you could do the same thing. Much harder to grab, but that works too.
And you can go over the top of the knee too, like this, and pull it this way.
Yeah.
And then you want, do you want double knees to chest? No, you don't.
Well, we can throw that in there, Bob. Sure.
Well, no, I probably should stick to the pattern here, Brad, because then you also want to go knee to the opposite shoulder, right?
Right. So then we're going to work some of that IT band, the piriformis muscle, and the hip. We're adducting it a little bit with the flexion.
So I'll show it on the opposite side here, Brad. So I'm bringing it forward. Now I'm going to the opposite shoulder, which is the right shoulder, left hip, right shoulder.
Right.
And I'm pulling it over, kind of giving the pressure that way.
Right. Well, I probably would grab it with that hand, but
yeah, with this hand. Yeah.
Yeah, he just was tied up with his yoga strap. Be careful with the strap, Bob.
All right.
All right.
And then what we're doing figure 4.
The figure 4. This is a real nice stretch that really can loosen some hips up.
Why don't you jump in, Brad?
Sure.
You work a little bit.
You know, when I get out of bed in the morning or when I put my shoes on, I'll do the figure 4 stretch in a seated position.
That's what I do all the time.
And when I put my socks on, I'll actually put a little pressure here, and boy, it feels good.
Why don't you show the difference between like a tight one and a one that's not tight?
Sure, and you might, someone might be able to do this very easily on one leg, and then the other leg,
it's way up there.
It's way up here, and it doesn't want to go down. It might be a little painful. So you're going to gently work it. Pressure on, pressure off. Maybe 10 repetitions is a good place to start. And eventually, you can hopefully get that to loosen up. And if you do get that to loosen up here, there's a good chance your pain in that hip is going to reduce along with that improved range of motion.
And then you're going to show it in a supine position or laying on your back.
Yep. So we can do it like this, and again, we can do the pressure on. Now, when you're laying like this, you're more relaxed, and it may be easier to start here and then go to the seated position if you do have that tight hip. Pressure on, pressure off, 5 to 10 repetitions like that, and do both legs. Even if the one side's not tight, I would do it anyways, at least 5 reps just to maintain it, Bob.
Absolutely.
Okay, now the other thing you can do from here is, and the yoga strap might be good here, or if you can reach. I've got a patient right now, her arms aren't long enough and she has a hard time reaching, so she's going to use...
Take the red side, make sure it's on.
Oh yeah, so they can see the red side. But you can
right away you put the gray side on.
Oh, look at that, Bob. I'm sorry, I could see it anyway. Sorry, man.
He follows directions really well.
Yeah, my wife likes that too.
Yeah.
And then we're going to work it like this. And a little bicep work here as well.
Yeah, this really works that IT band, doesn't it, Brad?
Oh, yeah.
On this side.
Right.
On the left side.
Now,
I've got a bonus stretch then, Brad.
Oh, you do? Well, I wanted to show the figure 4.
Oh, yeah.
In the straight position.
Sure.
A lot of times for assessment, what I'll do is...
So he's a 4.
Right, if you're looking down.
And here's the 4.
Exactly. Yeah. But I'll have someone laying down, for the first assessment, and I'll I won't measure it. Usually I can just go by visual. How far does the knee go here? And then how far here? And even mine, look at this. This is my normal range. And
you are tighter on the
right
side.
My right side is tighter. I'm not exactly sure why, but I better work on that a little bit.
Yeah, you better.
See, we just did a little assessment right now.
That's right.
Bob, could you document that, please?
I will.
There you go. Thank you. Okay, but then you can stretch it. Right now I have a patient, she does not tolerate it here, but she does tolerate it here. She has a knee replacements too, which is another.
Do you want to show that seated too, Brad? I mean, just, like frog style or whatever. Oh, no, doing both legs at the same time.
Oh.
Doing this.
Can you
do that?
I think so.
That's a good hip, right?
I used to do this
hip abductor,
all the time in karate. Yeah. Yeah, this is good to get those side kicks up, Bob. You could see some of our videos on karate. We got about 7 of them. Oh.
See no evil. See no evil,
Bob,
hear no evil.
Why, Bob? Why? Every time it comes up, he pulls up one of those stereotypical issues. I'm going to have to get.
Okay, we can also do a stretch like this, Brad. Move out of the way once here.
I'm not done yet, Brad.
Well, get done.
Feels good. All right.
All right. This would be a hip adductor stretch too, wouldn't it, Brad? This would be a little more advanced. Right?
Yeah, right. I would say so. You have your balance.
Yeah.
But
that's a great stretch.
Yeah. Oh,
that's
yeah.
a great way to stretch.
So,
all right, always throw in some bonuses.
Right.
Always give more than the people want. That's what I say.
A little extra. It's a very good practice. The thing is with therapy, we have a lot of fun, joke around a bit, but the body works out better, relaxes more when you do have fun. We do that with our patients as well.
Remember, Brad and I are not just pretty.
We're pretty ugly, Bob.
No, we're pretty helpful. That's why you're going to want to make sure you subscribe to us.
That's right, yeah.
All right.
I always get that wrong.
Thanks for watching.